Hormone replacement therapy, HRT, is having a resurgence as more doctors are prescribing it to treat menopause symptoms. And more women are openly talking about it with their friends and, of course, on social media. In fact, HRT demand was so high, there was an estrogen patch shortage. And the treatment can be life-changing, tempering hot flashes, lifting the brain fog, and helping women feel more like themselves again. But millions of menopausal women can't take HRT for medical reasons, including breast cancer survivors. In fact, a recent New York Times article reported on their struggle to find relief and their frustrations over feeling left out of this treatment. Let's bring in Dr. Mindy Goldman. She is the Chief Clinical Officer at women's telehealth company Midi Health and a UCSF clinical professor. That's the University of California, San Francisco. Dr. Goldman, thank you so much for being with us. You're also the director of the UCSF Gynecology Center for Cancer Survivors and At-Risk Women. So many women who have survived breast cancer are thrust into early or severe menopause due to their treatments. What are some of the misconceptions you've heard from these patients that are safe alternatives to HRT?
I think a lot of breast cancer patients get the message of be thankful you're alive and just deal with the side effects. And that just isn't true. There are many alternatives to HRT to treat many of the symptoms of perimenopause and menopause. We have both off-label use of non-prescription drugs, so non-prescription hormonal, non-prescription drugs as alternatives to hormones, as well as FDA-approved non-hormonal formulations to treat things like hot flashes and night sweats. But I think one of the other big things that's a misconception is people think if I'm not a candidate for hormones, that means no treatment at all. And that's really what's not true. We know with menopause that it's not just the hot flashes and night sweats. Weight gain happens, people aren't sleeping, bone loss, brain fog, the incidence of diabetes goes up, lipids go up, incidence of cardiovascular disease goes up. And we have safe and effective treatments for virtually all of those things. And so the message I try to tell to my breast patients is do not think that it's just hot flashes and night sweats. If it is that, we have plenty of treatments, but know that the conversation is much, much broader.
And this is really changing in the medical community, right? Because there was this misconception for many, many years that hormone replacement therapy can potentially cause cancer. So once again, for our viewers, where does the science stand on cancer risk and hormone therapy? And what is your advice to breast cancer survivors with this?
Okay, so let's talk in the general population, because I think you're right. There still is this misconception that hormones may increase the risk or cause breast cancer. And some of that really dates back to the old Women's Health Initiative study that's gotten a lot of press, even recently. That was published now 25 years ago and raised the alarm bells that hormones increase the risk of breast cancer. We know now that the risks of that were overblown. That study also looked at a very specific formulation of hormones. We use different formulations of hormones now that are thought to be safer, more breast neutral, have different risks in general. So what we also know now is, separate from the breast cancer concerns, that if people start hormones at the appropriate time in life, which is typically soon after menopause or under age 60, that hormones can not only treat those symptoms but prevent disease, prevent cardiovascular disease, which is the #1 cause of death, preventative for bone loss, osteoporosis, and increasing data that suggests there's a timing hypothesis for cognitive health as well. And so virtually most women in the perimenopause and menopause are good candidates for hormone therapy. But what's happened is there's still all of this leftover from the Women's Health Initiative that people have this cancer risk, and so they're afraid of taking hormones.
What about the people out there, women that may be between the ages of 35 and late 40s, who could be in that perimenopause area, and they're curious about HRT, don't really know where to start? Maybe their doctor isn't necessarily well versed on the different treatments out there. Where do you start when you are a woman who's starting to experience maybe some of those symptoms, want some solutions, but it's overwhelming, frankly, all the information out there, and where you can go for help?
Sure. So certainly come see us at Midi Health.
Yes.
That is our main focus, is helping women with perimenopause and menopause. We are virtual care in every state in this country, insurance covered care. But to your question, I think perimenopause is actually more confusing than menopause, because what happens is people start experiencing all of the same symptoms you see during menopause. All of the hot flashes, night sweats, mood changes, sleep difficulties, many symptoms, yet they're still having periods. And so people think, oh, there must be something wrong with me, and they start doctor shopping. They're having joint pain, and they're sent to an orthopedic. They're having palpitations, and they're sent to a cardiologist. All sorts of specialists they start seeing, and no one's putting the picture together. So I encourage people, if you're starting to feel different than you usually have, if your periods are changing, you're starting to experience those symptoms, and know that it can start as early as the mid to late 30s, seek out care. Don't just say, oh, it's just a part of aging. Come see us at Midi, or find a specialist who understands menopause, but seek out care and don't just say, oh, this is something I should be dealing with.
You know, once you start hormone replacement therapy, it is kind of a process. And I'm curious if it's, once you start, is it something that's constantly evolving as you age, as your body changes? Is this something once you start, it's a journey that will change from year to year?
It can for some women. It's not that once someone starts, that's it, come back and see me in 5 years. You oftentimes need to iterate. It takes a little bit of time to get the right dose. And there's different types of hormone therapies. For example, vaginal hormone therapy is different than systemic hormone therapy. So systemic hormone therapy nowadays is often a patch of estrogen and a capsule, a pill of oral progesterone. But vaginal hormone therapy, vaginal estrogen, helps out with different symptoms, helps out with chronic UTIs, urinary urgency, frequency, vaginal dryness, discomfort with penetrative sex. So it's important to realize that starting on a patch and progesterone may help out with some symptoms. Other symptoms may change with time, and it's important to see an expert that can really guide you through that process.
All right, thank you so much.
Thanks for having me.
Dr. Mindy Goldman, always great to see you.